In labs and hospitals all over the world, there's this machine, an autoclave, and its only job is to get something perfectly, absolutely sterile. But here's the thing, when lives are on the line, how do you prove it worked? How can you be 100% certain every single time? Well, let's dive in. I mean, that's really the question, isn't it? In medicine, in biotech, mostly sterile is just a nice way of saying not sterile at all. There is absolutely zero room for error. So how do you go from just trusting a machine to having cold, hard, documented proof that it's doing its job? So meet our main character for today, the autoclave. It uses this incredibly intense combo of superheated steam and pressure to obliterate every single microorganism. But our job isn't about pushing the start button. It's about understanding the unbelievably rigorous process that proves, beyond any doubt, that this machine is flawless. Look, in these kinds of industries, you can't just plug something in and cross your fingers. You need a formal, documented process called validation. And this isn't just some good idea, it's often required by huge international standards like ISO 17665. At its heart, validation is all about creating an undeniable paper trail of proof. This entire thing really just boils down to one simple concept. How do you build justifiable trust in a machine that you absolutely have to count on? So let's walk through exactly how that trust gets built, step by step, through a series of really demanding tests. The best way to think about this whole process is like a gauntlet. It's a series of 3 intense trials. Each one builds on the last, and every single new autoclave has to pass them all to get certified. They're known by their initials: IQ for installation qualification, OQ for operational qualification, and PQ for performance qualification. Okay, so the very first trial in our gauntlet is the installation qualification, or IQ. You can think of this as the ultimate pre-flight check. Before this machine even thinks about running its first cycle, we have to prove it was built and installed exactly to spec. And for IQ, it is all about one thing: documentation. This is where technicians methodically verify and, more importantly, record every single detail of the installation. You're basically making sure the machine is set up for success right from the very start. And the details they check here are just wild. We're talking about confirming the exact voltage, the exact water pressure, making sure the drain can handle a flood of scalding water, and even getting out a bubble level to make sure the machine is perfectly flat. It's an absolutely exhaustive checklist. But out of all those checks, one of them is, without a doubt, the most important: calibration. Because at the end of the day, an autoclave is really just a fancy, high-pressure hotbox. If its own thermometer is lying, the whole process is a complete failure from the get-go. Now, what's really cool here is this idea of a trusted standard. See, calibration isn't guesswork. The technicians use a totally separate, super accurate device that's been certified against a national standard, like one from NIST, the National Institute of Standards and Technology. You're basically comparing the autoclave's thermometer to one of the most accurate thermometers in the entire country. And the stakes for getting this right are just massive. A tiny, tiny error can have huge consequences. The source material points out that a cycle running just 2 degrees Celsius too cool can slash the effectiveness of that sterilization by nearly 20%. And that's a tiny error the machine would never even know it's making. And that's why the type of calibration matters so much. You could do a quick single-point check right at your target temperature, sure. But that tells you nothing about what happens if the temperature dips or spikes. A multi-point calibration, though, checks the sensor's accuracy across the entire range. It proves the sensor's telling the truth when it's heating up, holding steady, and cooling down. That's how you build real trust. All right, trial 1 is complete. We've proven the machine is installed and calibrated perfectly with IQ. Now we can move to the next stage of the gauntlet, the operational qualification, or OQ. This is where we finally get to run the machine through its drills. OQ is all about function. It's like a flight simulator before the first real mission. We're testing to see if the machine can actually run its programs correctly and, just as important, if it knows what to do when things go wrong. So the very first drill is to map the temperature of the empty chamber. And here's a little counterintuitive fact for you. Heating an empty chamber evenly is actually harder than heating a full one. Without a bunch of stuff in there to absorb and spread the heat around, you get more hot and cold spots. So this is a surprisingly tough first test. So after it passes the empty chamber test, we start adding simulated loads. These are items specifically picked to be just like what the lab will be sterilizing every single day. Glassware, liquids, surgical tools. You have to see how the machine performs under real-world conditions.
So far, we've only been testing for success. But any good engineer will tell you, you also have to test for failure. What happens when the machine can't do its job correctly?
And this is just brilliant. It's the whole concept of testing for a correct failure. A huge part of OQQ is deliberately triggering alarms to prove the machine fails safely. So for an over-temperature alarm, we don't just want a little light to blink. We need documented proof that the buzzer goes off, an error message is printed, and, most importantly, the steam supply is instantly cut off. We're proving the safety features work exactly as they should.
Okay, we've passed IQ, we've passed OQ, the machine is installed right, it runs its cycles right, and it even fails right. Now, it's time for the final exam, the ultimate proof, the performance qualification, or PQ.
You see, the PQ test doesn't just rely on temperature probes anymore. It uses the real enemy, live microorganisms. Specifically, these little vials that are packed with a known quantity of Geobacillus stereothermophilus spores. These things are legendary for being incredibly tough to kill with heat. The thinking is, if you can kill these, you can kill literally anything.
Now this is where the logic gets really, really clever. Instead of just running a normal cycle, they use something called the half-cycle method. They stick those vials of super tough bacteria into the absolute hardest to reach parts of the load, and then they run the cycle for only half the normal time. Afterwards, they incubate the vials. If there's zero growth, meaning every single one of those microscopic tough guys was killed in just half the time, well, that gives you an enormous margin of safety. It proves that the full cycle is overwhelmingly effective. So, that's the gauntlet: installation, operational, and performance qualification. When you take a step back, you realize it's a journey. It's a journey from just assuming something works to being absolutely certain, all backed up by meticulous, undeniable proof.
And this quote from the source material just sums it all up perfectly. The goal of this whole thing isn't just to have a working machine. It's to have the documented, verifiable proof that gives you absolute confidence in the results of every single run.
This is the hidden science of certainty that so much of modern medicine and research is built on. It kind of makes you wonder, doesn't it? What other invisible, highly structured processes like this are out there, working in the background, keeping our world safe and reliable every single day?